Good afternoon. My name is Shata Clavering, and I'm a business development manager at OCE. I will be the moderator for this session today. I welcome you all to the University of Toronto and OCE organized webinar entitled COVID-19 Surface and PPE Decontamination, How the Science of Clean is Driving Public Health and Safety. We have a packed agenda with an impressive lineup of speakers covering surface decontamination from various angles. I remind our presenters that we will have 5 minutes for each presentation, leaving us with 10 to 15 minutes of Q&A. I encourage those listening in on the webinar to post your questions using the Q&A tool at the bottom of your screen. Please feel free to type your questions anytime during the webinar, and we will try to get all of them at the end of the presentations. Without further ado, it's my pleasure to introduce Professor Ramin Farnood, who will be providing us with his opening remarks. Ramin received his PhD in chemical engineering from the University of Toronto in 1995. He subsequently held various industry positions at Pulp and Paper Research Institute of Canada, now FP Innovations in Montreal, and Trojan Technologies. In 2000, he joined the Department of Chemical Engineering and Applied Chemistry at the University of Toronto, where he currently serves as Vice Dean Research of the Faculty of Applied Science and Engineering. He is the scientific lead for the University of Toronto's COVID-19 Decontamination Technologies Initiative. Ramin's research interests include wastewater disinfection, photocatalysis, membrane separation, functional materials, and mathematical modeling. He's a member of numerous industry associations. Ramin, over to you.
Thank you, Shata, for the introduction, and good afternoon. I'm Ramin Farnood, Vice Dean Research at the Faculty of Applied Science and Engineering at the University of Toronto. On behalf of the University of Toronto and the Faculty of Engineering, I would like to welcome you to this webinar. Over the past few months, we saw the rapid spread of COVID-19 that has resulted in a significant human toll across the world. It has changed every aspect of our lives with devastating social and economic impacts. It hampered our education system, disrupted public services, and forced governments to close businesses. But as the restrictions are gradually lifted from the COVID-19 shutdowns, it is important that we implement measures to reduce the risk of the spread of this disease and to protect the safety of the general public and our workforce. For this reason, contact routes continue to be of significant concern, and recent evidence points to the possibility of airborne transmission of this virus. Daily activities, including surface touching, coughing, sneezing, and even talking, are suspected to cause contamination of indoor air and surfaces. Over the past few months, thanks to an unprecedented global research effort, we have advanced our understanding of SARS-CoV-2 infection and transmission. However, many more questions remain. To address some of these challenges, with the generous support from Michael and Teresa Wu, we have initiated a research program at the University of Toronto to develop, test, and deploy COVID-19 decontamination technologies for surface disinfection. Our approach relies on university, industry, government partnerships that brings together academic researchers from across many disciplines, as well as technology providers, end users, and standards and regulatory experts. We believe this integrated approach is necessary to find effective solutions to this formidable public health challenge. On this note, I'm thankful to Ontario Centre of Excellence to co-hosting today's webinar as a forum for the exchange of ideas, and I'm pleased to see we have so many participants online. But before I sign off, I'd like to also thank Shata for moderating today's event, and Adriano Visa and Colin Swift from the University of Toronto for helping to organize it. And last but not least, I need to thank our distinguished panelists for taking time from their busy schedule to join us. I look forward to a productive meeting. Thank you.
Thank you, Ramin, for these insightful remarks. It's my pleasure to introduce our next speaker, Professor Frank Gu. Frank holds an NSERC Senior Industrial Research Chair in Nanotechnology Engineering in the Department of Chemical Engineering and Applied Chemistry at the University of Toronto. Before joining the U of T in July 2018, he was an associate professor at the University of Waterloo. Frank has over 15 years of experience in nanotechnology drug delivery, and environmental remediation. He has established a frontier research program in nanotechnology engineering with important advances in medical and life science applications. His research has brought tangible impacts on his field and industry, including mucoadhesive materials for the treatment of dry eye disease that has led to the creation of mixed therapeutics, and photocatalytic water treatment technologies that created H2 Nano ink. Frank, the floor is yours.
Thank you very much, and thank you for inviting me to briefly describe our work here today. Oh, sorry, I'm just going to turn on my video. Okay, hi everyone. If I could ask to advance for our next slide. So I'm here to talk about this recent work that we have developed as a collective consortium issue approach to tackle this COVID pandemic, particularly on PPE, personal protective equipment, facial respirators. When this pandemic first started back in February, one of the things we realized was that there is a dwindling supply of PPEs. And even till now, as the supply has gradually become stabilized, and there's still a pandemic concern of what is the maximum efficiency that we can use and how many times that we can use facial respirators. So as a group of researchers from University of Toronto and local hospitals, we have collectively formed a consortium called the Toronto N95 Consortium. And I'm here to introduce you about what we do and some of the major activities and opportunities for partnership. Next slide, please. So what this consortium team is really a group of experts from professors, physicians, clinicians, and the graduate students that are compiled from everywhere from the campus at University of Toronto, affiliated hospitals. We also have our partners from provincial and local stakeholders, regulatory agencies, and also members from the National Microbiology Laboratory. And together, what we're hoping to understand is when it comes to facial respirators, what is the best practice towards use of facial respirators, and what are the ways that we can decontaminate or reuse these facial respirators? And as a summary, we have the team has compiled a list of technologies from the one that are currently used in commercial practice, as well as the one that are being trialed prior to commercial level, and look at how these technologies could be used towards prolonging or extending the use of facial respirators. The one of our focus is N95 respirators, but we have since moved on to a number of other facial protective equipments, from surgical masks to other novel materials. And so what we're hoping to do is to understand how do viral and microbial particulates that penetrates or affects the facial respirators. And it uses knowledge to help us to translate the translation practice for COVID. And then we have also started to incorporate into other future pandemic concerns, from influenza to tuberculosis. Next slide, please. And one of the things I wanted to mention here is we have a lot of work that we have done is really about compiling literatures and compiling data. To date, we have developed a library of over 200 N95 masks across 9 different model numbers, and test them on the decontamination efforts across 11 different tools that are commonly used for decontamination. And this includes some of the most commonly known, from UV to hydrogen peroxide vapor, and moist heat, and chlorines, and ethanol vapors, and etc. And one of the things I'd like to share with you towards at this webinar here is that one thing that we found was that the use or reuse of respirators, the most vulnerable task here isn't really the technology of repurposing them, but rather is how we are ensure that the users can properly wear the mask. So in this recent literature that we've just submitted for publication, we documented that the use of N95 respirators, the most vulnerable part is about not wearing the mask properly, as opposed to the recycling methodologies and the tools that are used to disinfect and decontaminate these masks. So in light of we're very interested in hearing communities and opportunities for collaboration with other partners to jointly explore this. But overall, as a consortium of researchers, we realize that this can really help us to develop the future framework towards assessing airborne exposure risks across respirators and other facial masks. Thank you very much for this opportunity, and look forward to talking to you.
Thank you, Frank. Very interesting. Thank you. It's my honor to introduce our next speaker, Professor Cynthia Go. Cynthia is Professor of Chemistry, cross-appointed to the Department of Materials Science and Engineering, the Institute of Medical Science, and the Mott School of Global Affairs. She's the founder of the Impact Center, an institute that aims to bring science to society. And she is the inaugural academic director of the University of Toronto Entrepreneurship. Her research interest focuses on the interactions and properties of very large molecules, which has impact on nanotechnologies, biomaterials, and biodiagnostics. Her research has led to 8 companies, which she has co-founded with her students. Cynthia founded Entrepreneurship 101 program, an introduction for students who want to be entrepreneurs, which later moved to Mars and expanded to thousands registered annually. In 2010, she founded Techno, an intensive training program for scientists and engineers who want to create science-based companies. And actually, above all, Cynthia was the PhD supervisor of my PhD supervisor. Cynthia, it's an honor. The floor is yours.
Okay, so that makes me your grandmother, I think. That's horrible. It's telling you my age. Okay, so today I'd like to talk to you about the coatings that we make in my lab, what I call my anti-COVID coatings. Please, next slide. Before we do that, next slide, I'd like to just clarify that I'm interested in disinfecting, which is about killing germs on a surface, which is different from cleaning, which is about the removal of germs, as well as dirt, as well as all sorts of impurities. And the question is for us is how often do we have to clean, disinfect, sanitize? Next, click. And according to Public Health Ontario, we have to clean frequently touched surfaces twice per day. Click. But you'll see, sorry, next slide. You can see frequently touched surfaces I've touched a lot, hundreds, dozens of times between the 2 parts, which is it's being cleaned 12 hours after it was cleaned previously, so that somebody is in contact with microbes because somebody deposited it within that period of time. So that's the problem we're trying to address. Click, please. Oh, sorry. Okay, so in between those cleaning and sanitation, many things happen. And so we'd like to address that gap. And next, please. And I call it continuous passive disinfection. Next. If you look at all the disinfectants that are approved by the EPA, and there's about 550 plus different materials that are sold, they all consist of the same 6 things. And all these 6 things can be good at killing, but they only would kill the germs when they are around. So once they're gone, then you have a problem. And that means for us, next slide, please. We want to develop something completely new. Next. We want to build new materials and then formulate them to create a surface coating. Next. The kind of materials that we have they're nano in size, they're suspended in solution. Next. And the first class will be about copper and copper alloys, because we know that copper, actually bulk metal copper, has been known to be antimicrobial for a very long time. But however, you cannot just coat all your surfaces with copper. So our solution is to put these nanomaterials, to create nanomaterials that are copper-based. And the second class are photocatalysts, which are materials that break carbon-carbon bonds in the presence of light. The third class, next, please. are cationic polymers, because we know that positively charged particles are really good at killing typically bacteria, but we think the SARS-CoV-2 is less resilient than bacteria, and they have an envelope that you can also destroy with a cationic polymer. But next, please. But since we do not know, next, how the mechanism of action of these different things, how do they really work, we figured that that's a nice subject for research, but for now we want to create a good coating. So what we're going to do is build all this material and empirically test which is the best formulation for a specific application. Next slide, please. So the first set of particles we're making are copper-based nanoparticles that are encapsulated in polymers. Next. This is a process that we know is doable, cheap, and scalable, because this is already being done by one of our spin-off companies to deliver materials for agriculture. But in this case, we're interested in making copper, copper alloys, copper oxide. Next. And one advantage of this material is because of the polymer shell, it's amenable to post-processing so that you can deposit it in a surface and allow it to grab if you want to. The next set, the next slide, of materials are photocatalysts. And this is a list of the kind of photocatalysts that, previous. The photocatalysts that are developed in my lab. And what we are intending to do is use a lot of this material. I forgot to tell you that when photocatalysts work, when light hits the nanomaterial, it creates a reactive species that breaks carbon-carbon bond. So it's generally good at breaking everything. But one important feature of it is it's catalytic, not stoichiometric. That is to say, it doesn't get used up in the process of breaking those carbon-carbon bonds. So we have many different types of photocatalysts in our lab right now. And of course, what we want to do is to select the best combination of materials to kill the appropriate microbes deposited in the appropriate surface. Next slide. So just to show you some example of results, if you have an uncoated surface, this is done in a friendly hospital. They coat half of the surface with our material, the other half is uncoated, and then you swab after 24 hours and then grow the bacteria. As you can see in the topmost dish, there's a lot of bacterial, well, I don't know what they are, but there's a lot of things growing, but not in the ones that we have. So it works very well. We also have to assess the concentration that works well. Next, please. Next. And here you can see this is for the photocatalyst. The dark bands, the dark blue, are in the dark, and the y-axis is proportional to the microbial count. And you can see that there's when it's in the dark, nothing happens. But when you put in light, the microbes disappear. And there's a concentration that is really good for above that, all the microbes are gone. Below that, it worked, but not very well. So these are the kind of steps that we're trying to do. Next slide. So in our lab, we're really looking at producing the nanomaterials and then evaluating their effectiveness and optimizing the mixture. And we're doing it against bacteria because that's what's easy to work on. And as I said, the justification is that the envelope in the SARS-CoV-2, it can be mimicked by a bacteria. What we need are partners to actually design and formulate to specific types of applications, whether it's an elevator button or it's the handrail in the stairs and so on. And so we'd like to have partners in that in order to be able to go to do field trials. In between, we will of course be testing the optimum surface with regards to SARS-CoV-2. So thank you very much. Next slide. And here's my contact information if you want to contact me. Thank you.
Thank you, Cynthia. That was not only a great lesson in chemistry, but in linguistics as well. Thank you. I'm happy to introduce our next speaker, Professor Graham Norval. Graham is a professor at the Department of Chemical Engineering and Applied Chemistry, University of Toronto. His areas of expertise are inorganic process chemistry of chlorine, caustic soda, hypochlorites, and sulfuric acid, as well as process safety management. Graham served on the Prevention Council, Ontario's advisory council to the Minister of Labour, to shift the approach from one of enforcement to one in which prevention became key. This has brought the principles of prevention through design to the center. Graham is the chair of the CSA Process Safety Management Technical Committee. The committee prepared and issued the National Standard for Process Safety Management. Graham, over to you.
Super. Thank you, Shasta. Could I have the next slide, please, Kim? So I'm going to start just by giving a quick overview of how the chemical business works. All of the chemicals we've already talked about, whether it's peroxides, quats, hypochlorites, or chlorine, produced by a smaller number of commodity chemical producers. They're selling bulk deliveries, typically rail car, often sometimes trucks. Everything's done under WMIS regulations, and they sell to the big consumers. So City of Toronto Water Treatment gets its chemicals from the major chemical suppliers. We've got another layer of people we call repackagers. So if you're getting things in drums, 200-liter drums, 1,000-liter totes, some jugs, these types of people are the repackagers. And then the people who sell most of the janitorial chemicals are the distributors. They don't manufacture, and essentially they will buy chemicals either from a commodity chemical producer, maybe a repackager. Some of them package the chemicals themselves, but often they just subcontract that out to other people. So sort of three different levels of people, but the janitorial and the cleaning chemicals typically are the distributors, not the commodity chemical producers. Next slide there, Kim. Now, the second vector that we have is the same chemical product falls under a bunch of different regulations depending who and how you're selling it to. So if I'm selling it to an industrial producer, it falls under WMIS regulations. If I package bleach and sell it in the store, it falls under the Consumer Product Safety Directorate, different labeling requirements. Bleach for swimming pools, for example, it's a pest control product. So that's another Department of Health Canada. If it's a hard surface disinfectant, that's the Natural and Non-Prescription Health Product Directory, and that's a different division of Health Canada. And finally, if you're dealing, it's a non-food chemical for food surfaces, you deal with CFIA. So the same product has to be regulated by different people, and the same seller has to be registered by each of those ones. And often people only target one specific of those different market pieces, and that's their little niche. So the next slide, please, Kim. So if we think about a typical problem that we might have, and one at the university, we'd say, how do we sanitize? And by sanitizing, we're reducing bacterial population. How do we sanitize a computer lab or a lecture room? And it doesn't matter if that location was a nail salon or a GO train or a TTC bus. How do you pick the chemical that you use? You've got a mixture of surfaces. Some of them are hard, some of them are fabric. You've got different materials of construction. Some are plastic, some are metals. And they have different use profiles or different amounts of contacting. How do you choose the product? And the person who actually is selling that product ends up being the distributor, not the manufacturer of the chemical. So we have this funny little piece where the people with the least chemical knowledge are actually selling to the people with the most difficult problem to deal with. Kim, the next slide. So we've already mentioned there's the typical solutions, hypos, peroxide, quats, alcohols. People generally get them as surface wipes, towelettes. You could spray that on by hand, or now people use ultrasonic foggers and create a fog and fill the room with fog. The piece that's missing is how much chemical do you fog? And is that on a per square meters of surface that you have to do? Do you ratio that, the volume that you're using per room volume? How do you adjust the factors that you're dosing for high-touch surface, low-touch surfaces? And if we get to the next slide, Kim, I've taken this slide from the newspapers. That's a picture of the Chinese fogging in Wuhan. Apparently they're fogging a bleach solution. And it'll probably be a 10 or a 20 part per million solution of hypochlorite, but you have a robotic device that's now spraying things everywhere. We haven't had that in North America or in Europe yet, but that's the high level. And you can debate whether or not that's beyond what we have to do. And then the next slide. The other piece that we've noticed, and you'll see the step change in the number of reports of poison control centers, not just in Canada, but this is across North America, across Europe, and all the developed worlds. An awful, almost a doubling in the frequency of people reporting to poison control centers because they essentially self-poison themselves, either by mixing hypochlorite with an acid toilet bowl cleaner, generating chlorine gas, mixing hypochlorite with a ammonia-based toilet bowl cleaner, making a chloramine gas. So the people who are being asked to do these things are actually the people who have the least amount of chemical knowledge. So the final slide there, Kim, please. Perfect, okay. So what we're missing, well, we need to move away from having just the person who knocks on your door and is selling the janitorial solutions. We need to move to an evidence-based sanitation choice. What are the materials that you've got for your surface? Are they plastics? Are they electronics? Are they fabrics? How do you choose the right sanitation choice? And then how do you apply that? Is surface wiping, is fogging, and what's the ratio? And not just the ratio, but also the strength. So all of these pieces are what's missing. In order to get there, we have to be swabbing before and after. We can be using bioluminescence detectors, ATP testers, but we can actually start to prove, are these things that people are doing working or not working, and how do we make them work better? And in the selection of all of these disinfectants, there are ASTM protocols and other standard groups that have protocols for proving that the product is a disinfectant. But what we don't have is, how do we get them applied? How do we know that the user is actually successfully doing the product and not just spraying on either too much, which isn't always bad, but also possibly too little and not getting the effect that they want. So super, so thanks very much for your attention, and I'll be looking forward to any questions.
Thanks, Graham, for sharing. That was very insightful. It's my pleasure to introduce our next speaker, Diane Richard. Diane is the founder and president of Diatom Consulting and Professional Training, Inc., which supports small to medium-sized manufacturing companies to help them with strategic planning and continuous improvement to achieve their growth and profitability goals. She has helped many Ontario companies develop research partnerships with post-secondary institutes to accelerate these objectives and open them up to global markets or unique market opportunities. She spent 25 years with DuPont and PepsiCo Foods Canada in progressive leadership roles in manufacturing and R&D. Diane, please go ahead.
Oh, sorry. Hello, sorry about that. Next slide, please. Next slide, thank you. Great, so Cynthia and Graham have actually set this up perfectly for me, because as they both mentioned, in the cleaning industry, there are basically 6 basic classes of chemistries that have been around for decades, but yet we found 550 different ways to modify them. And so this is a very interesting study. It was a client that has 60 years of history in the cleaning industry, developing some of those 550 products. And they had launched many new products. And they really wanted to understand a little bit more, just as Graham said, is what is the real world like? Often these products are developed in the lab. You saw pictures of in a Petri dish. Health Canada is very prescriptive around how they're testing, but they really wanted to do their due diligence with their client base that they've had for decades to validate that the way that custodian or that nurse or that person in their home is using it properly and real-world cleaning, using real-world cleaning protocols. Said differently, wouldn't all of us right now really love to be able to validate as we go back to school, as we go back to our workplaces, that those cleaning protocols do make us healthy and safe? Next, please. So again, being in this industry, there were many different types of science out there, whether they be claims of the company or their competitors, literature, being to conferences such as this. So there was many different tools and techniques that we had in our basket. And so really what we wanted to do was to take a number of these. We probably had 100 different hypotheses that we started with from the literature search and said, how could we validate it and replicate real life a little bit better? Next. So how did we do this? Well, luckily through the Industrial Collaborations Office at University of Toronto, they set us up with Dr. Christopher Yip in the Institute of Biomaterials and Biomedical Engineering and helped us secure a postdoc with experience that we needed. They also were really helpful to, Dr. Yip reached out to a colleague actually at McMaster University, who's a microbiology, who had a lot of experience in this field with different pathogens that are within inside a biofilm, which is a concern. Also, we were able to leverage some NSERC funding and OCE for this client. What did we do? So how did we set about to confirm and look at all the claims and research that we had and match it with the experience and the training that we give the client base? So we created a proprietary investigation chamber, and what this was had was advanced cameras, microscopes, filters, spectrophotometers, and in this controlled chamber, we were able to introduce different types of bacterial cultures. We were able to grow biofilms and compare performance. Why this is relevant is, as somebody mentioned earlier, bacteria just, although we have to test it, the kill claim, for example, against E. coli or Salmonella or COVID-19, the real world is a soup. Biofilms, you can think of that sponge beside your sink, and it's a home with lots of food where there's bacteria, viruses, fungus, and organic material. So we really wanted to grow that type of surface and then compare how different disinfecting protocols work. And really it was, again, to replicate what we knew about how customers were actually using the products, because we had access to their standard operating practices. Next. So just in general, a lot of this information is proprietary because of the nature of how it was used for future development. But what I can say is, some of the hypotheses that we saw were confirmed, but also some of them were refuted. Most importantly, we generated some novel insights on our own that around how to look and measure bacteria in these type of systems. We created compelling images and videos and data tables to engage infectious disease professionals. As you can just imagine, there's a lot of competitive products out there. We just talked about the 550. How would people know which are better, which of these claims they can trust? And I can just tell you, a picture is worth 1,000 words. A video is even better. So seeing how it actually reacts in these conditions helped to really drive that discussion and future collaborations. Most importantly, it gained insights into a game-changing innovation for the cleaning industry. And it taught, as Graham mentioned, we have to be able to see the bacteria real time. There's limitations on swabbing and the time to turn them around, limitations on ATP and what it picks up. And so this has led to the launch of a bacteria imaging camera, so that there's a better tool out there now to real-time image bacteria. And it has spawned several ongoing collaborations with the University of Toronto in this field. Next. So again, what I tell my clients on the industrial side of it, even if they've been around as second, third, fourth generation businesses, it's really important to know that there's a better way. Lift your head up every now and then, get some help, and leverage partnerships such as the universities, as well as OCE as well, who's sponsoring this. So thank you very much for this opportunity.
Thanks, Diane. That's very interesting. Thank you for sharing. And last but certainly not least, I'm happy to introduce Wendy Reuter. Wendy serves as the VP for the Canadian Urban Transit Association, where her member-focused team actively pursues data and research ranging from integrated urban mobility to infrastructure, autonomous vehicles, ITS, greening and resiliency to advance Canadian transit systems. Wendy currently volunteers on TAC Mobility Council, Ontario Public Transportation Board, and chairs the National Research Council of Canada's Automotive and Surface Transportation Center Advisory Board. Wendy has studied transportation technology and holds a BA in economics from the University of Toronto and an MBA from Richard Ivey School of Business. Wendy, please proceed.
Thanks, Shatha. Thanks for that introduction. So I'm grateful to be here. I'm grateful for the invitation. I think my introduction bespells that I'm not of the caliber of researchers that I have the opportunity to join on this webinar today. I'm here hoping to provide a bit of perspective on the impacts of COVID within an industry, within the Canadian public transit industry. There are demands. There's demands for cleaning, disinfecting, sanitizing. So thank you, Cynthia, for those distinctions within the industry as we endeavor to keep people moving and as we endeavor to keep people moving safely, our passengers and our operators. And so I thought I'd spend my 5 minutes just sharing with you impact of COVID on the industry and where some of these needs, where these needs are. So Kimberly, next slide. And we can go quickly to the next slide as well. It's just a little on CUDA. Just to give you a sense of who CUDA is and who we represent and the perspectives we have. We are a trade association. Almost all the transit systems in Canada are members of CUDA. So there's about 130 transit systems in Canada. They represent rail systems, whether it's commuter rail or subways, light rail, bus operations across the country, as well as specialized transit also across the country. And each of those modes have had impacts as people make choices in how they move around. They also have different needs in terms of their relationship of passengers to vehicles and passengers to operators. So as you can envision on rail, operators aren't in close proximity to passengers. In bus, there are some. We'll talk about that. And in specialized transit, the relationship of operators to passengers is even that much more close. So the questions of cleaning, disinfecting, and sanitizing are important across the board, but they can range quite a bit as well. Our members represent almost all of the passenger transit in Canada. If measured by ridership, it's 98% of all the trips that are provided across the country. So a lot of transit systems coming together to talk about what the issues are with respect to COVID, how they're managing, sharing what they're doing, sharing best practices, innovations, issues. They come together and discuss how they might move forward. Next slide, Kimberly. So a quick slide of history, and my little bar is so small it might not even be noticeable. Prior to COVID, this chart represents ridership in Canada, transit ridership. Prior to COVID, transit trips in Canada had surpassed 2 billion. So that's number of passengers taking public transit throughout the year, 2 billion trips. And that's the volume that we're looking for solutions for in continuing to operate. When COVID hit, of course, people stopped moving around the way that they were used to. They stopped going to work, they stopped going to retail, they stopped going to school. We all know that experience. But as a result, the decline in public transit happened as rapidly as all of those other changes in our patterns of movement. Transit ridership dropped to about 15% of what it was in February of 2020. And it's been pretty newsworthy as to the financial impacts of that. Some of the ways that transit adapted in those very first few weeks as we were figuring things out were changes in levels of service. To some degree, levels of service declined. I would characterize by the end of March, when we were all really shut down, that levels of service for transit were about 60 to 70% of what they had been in the February before. We were working really diligently about providing distancing for those passengers that needed to continue to take transit. And on the right-hand side is an image of some of the ways that we were practicing distancing. Transit needed to run. It was still providing services to essential workers, which in the first phases were medical support, emergency services, grocery store workers, those manufacturing, those businesses that can continue to need to run to support the rest of us. those workers didn't have the opportunity to work from home. They needed to go in to work. And in many cases, they were dependent on transit. And transit was an essential service for that during that period, getting them to their employment. So we still had 15% of service of passengers riding transit, even in the most constrained times of COVID. We managed that through levels of service. We managed it through distancing. The other way we managed it, in addition to increasing our cleaning, increasing our sanitation, increasing our disinfection, and trying to share with each other who's trying what, who's researching what, and coming together to share what those resources were, was to introduce rear door boarding for passengers. That provided some distancing between the passengers and the operators. It also meant a period of time where there was little fare collection as passengers were directed to enter through the rear door. So for many transit systems in Canada, they're still in that mode. They're still continuing to have passengers enter the rear door as opposed to the front door. Those that have returned to front door boarding have generally introduced plexiglass or other types of barriers for the driver to create a physical barrier between the driver and passengers as they're entering. So the transit systems that have installed those have generally proceeded to resuming front door boarding. And I would say that as we enter the summer, and a lot of jurisdictions are in around stage 3 of opening their economy, ridership across the country is now between 30 and 50% return. And we're now kind of looking to what our line of sight is will be for the fall as more businesses open, as universities come back to operation in new ways. So the impact on transit has been acute and quick, and the return to ridership has been increasing, and our focus has been on keeping passengers and drivers safe throughout this. So we continue to look for ways to do that and ensure public confidence. Next slide, Kimberly. Thank you. So this is just a recap of some of the items I just referred to. But the chart on the right, or sorry, on your right, is really indicative of where the kind of the public mobility mindset is at right now. This is either, I don't remember if this one is Google or if it's Apple mobility data, but it's showing the route searches for destinations. So like a Google Maps, how many searches for directions are people looking for by walking, by driving, and by transit. And over on the left-hand side, it shows prior to COVID what their normal state was. And you can see over to the right that the searches for how to get places by walking or driving has increased more than pre-COVID levels. And the inquiries for moving by transit has not resumed yet to the levels of pre-COVID levels. So we want to find ways to keep those passengers thinking about transit, looking for transit to be a safe and accessible option for them. Next slide, Kimberly. Okay, so what's important to customers? This is what we understood around April of COVID, and what we continue to look to as though the percentages might change. We know that a certain portion of people were comfortable or willing to use transit very early on. 5 to 15% continued to do so or needed to. We know that a portion will not return to transit until there's a vaccine, and that's about 25%. There's been a variety of studies done on this in different cities across the country, and these are averages. But what we do know is that for the middle group, the things that we can do to help them feel comfortable and make transit safe for them to resume using. And these are the things that we can focus on in terms of how we can create a clean, sanitized environment. passengers wearing masks, an environment where passengers are wearing masks. Now that's much more commonplace. The obvious cleaning and how we can do that in ways that's effective, distancing, and that it's coming from a trusted organization, that transit is very transparent about what we're doing to keep passengers and employees safe. So we want to focus on sharing the information of what's happening to do so. Next slide, Kimberly. Some of the things that are underway right now, and where I think that opportunities like collaboration in a webinar like this, where we can look for opportunities about who has possible solutions to who has issues. This is where we can look for those places of common ground. Some of the areas where transit is working right now on cleaning and disinfecting and other engineering controls to keep people safe are around the driver barriers and rear door boarding, contactless payments, cleaning in high touch areas. We heard Cynthia talk, question what's the right frequency depending on the right products. Solutions like fogging that can help make the cleaning process more efficient. Masks, of course, for passengers and employees, managing loads, and questions around facilities. And CUTE has provided some guidelines for transit systems that look for what the best practices are. And we're looking to continually update those as we know more. And as you know more, as your research shows better practices, we'd like to be updating those guidelines to share with transit systems what the best practices can be and where new innovation is becoming available. So again, I'm really grateful for collaboration in a webinar like this. I think it's a fantastic opportunity for those that are working in the field to be able to benefit from the research coming that's being developed and finding places to improve the things that we can do in the industry to keep everybody safe. Next slide, Kimberly. And actually, that's my summary. These are some of the other things that CUTE is doing to help the industry. The impact on revenues for transit has been a loss of revenues of about $400 million a month. So there's a lot of work that we're doing in the advocacy side of things to assist transit systems to become whole in the operations. We're wanting to protect levels of service, keep service levels where they need to be to enable distancing for passengers and continued mobility options for them during COVID, and continued communication with them and mechanisms for sharing new information when it comes out, whether it's weekly webinars like this one and newsletters. We've got distributions that we can share with all of those transit systems in Canada. So again, thank you for the opportunity for joining all of you and esteemed panelists on this panel. I'm really appreciative of the research that you're doing and how that might come and benefit our industry. Thanks.
Thanks, Wendy. Very great insights. And actually, it's like, I'm feeling like it's insider information. I'm so excited to hear because most of us use TTC or stopped using it, but we don't know the real impact about it. So it's really great to see the numbers. Thank you again. Right now, I would like to give you a brief description and brief flavor about what we do at OCE. For those of you who do not know OCE, Kim, please advance. We are a non-for-profit organization funded by the province, and our mandate is really to connect people together because we believe that when we connect people, this is what drives innovation. And we see ourselves as catalyst of innovation in the province by connecting SMEs, industries, academic institutions, together with regional innovation centers, all these players in the innovation ecosystem. When we connect them together, this is where, as we say, the magic happens. This is where innovation happens. And in turn, our bottom line is to bring prosperity, growth, and job creation to the province. Next. So we do that through two areas. One area is through our program funding, and the other area is through our large network of contacts that we have through the province, because we have a strong business development team spread east and west, north and south in the province. Whatever city you name it, we have somebody there. And the mandate is really to connect these people together again, because we catalyze innovation. And similar to chemistry, what catalysts do in chemistry is they try to grab one element to make it, and to get the other element and collide them together and make the opportunity of them to talk to each other happening better, so that the reaction will happen faster. So this is what we do at OCE. We try to connect people together so that the innovation can happen faster. The other aspect is our programs, and our programs are divided into 5 different segments. The first one is IP and research commercialization and collaboration between academia and industry. This is what we call the VIP. So if you are an SME or an industrial company and you'd like to work with a professor, we will be more than happy to facilitate this type of relationship. The other program is our AVEN program, Autonomous and Connected Vehicle program. Anything related to autonomous vehicles, whether it's the AI systems, whether it's the sensors, even the infrastructure, this program can help you through connections as well as through funding. Encore 5G program is collaboration between the large telecommunication companies, Ericsson, Ciena, and Thales. And the idea is to build the hype and to encourage SMEs and startups to use the 5G testbed and to be familiar with the 5G before it becomes a reality in Canada. The other program is the IBM Innovation Incubator Hub, where it provides IBM computing powers to startups and SMEs to advance their technologies and innovations. And the last one is the Next Generation Network program. It's a collaboration with the Center of Excellence for Next Generation Networks, where companies will have access to data center, where they get simulated data to stress test their algorithm. Click. Thank you. I just want to spend a few more seconds on the VIP. The VIP is the collaboration program between industry and academia. It can be a university or a college. OCE could provide up to $150,000 over 2 years. The match is 1-to-1, with half of that being in cash by industry partners. The other part of VIP is OCE has developed a partnership with NSERC. So we created NSERC VIP program, where we fund up to $30,000 from OCE, $30,000 from NSERC over 1 year, and the industry contribution is $15,000 cash. And this program is really designed to help commercialization of IP from the university, as well as to help bridge the gap between industry and academia, so that to encourage the two to speak together and to work together. Next, Kim. And in terms of COVID, what OCE has done, because we understand that companies are pivoting, as we heard today. Companies are looking into disinfecting masks. They are looking into doing sanitization and making ventilators. So this is where OCE saw the opportunity to help out. We developed a COVID-19 collaboration platform. It's an online platform where we received about over 400 companies. And these companies were SMEs, startups, industrial partners, big and small, regional innovation centers, as well as research partners, including universities and teaching hospitals, as well as colleges in Ontario. And we were able to make over 400 connections between these people. And what was happening in that platform is really impressive, because we were getting companies asking for help. Hey, OCE, I need some help navigating regulatory. Do you have any connections with a regulatory consultant? Hey, OCE, I need supply chain management. Can you help me with that? And then we have the other side of the spectrum, where people were coming to us saying, hey, OCE, I'm offering this. Does anybody need that? So this is how we were trying to connect the dot and kind of match people together. So we were doing a little bit of matchmaking here. Kim? And this is just an example of the successful dot connects that OCE has made in the past through COVID-19. And I just want to highlight a couple of them because they are related to decontamination. One of them is Clean Slate UV, and the other one is Clean Works. Clean Slate UV, obviously, because now they shifted and pivoted into more decontamination of surfaces. So their sales increased by 15%, and they didn't have the supply chain to accommodate this. So they asked OCE for help, and this is when we helped them to secure their suppliers. The other example is CleanWorks, and CleanWorks is another example of a company that has a product, and now they want to use it to fight COVID. And they were looking for researchers to help them test it before they commercialize it. And we connect them with professors and researchers at UHN, where they are now collaborating to test this product. That's it for me, and I hope I was able to give you a little bit of flavor about OCE and what we do. So if you have any questions, please feel free to email me. Here is my contact information. And if you are not sure whether you are a fit for any of OCE programs, I assure you that we can either help you, whether it's through our programming or whether it is through connecting the dots and connect you with whoever you need to be connected with. So thank you again. And now I'm gonna look at our question and answers here to see. We have the first question. Can COVID virus be absorbed directly through skin? If so, what dosage enough to cause illness? Do we have any of our scientists who is capable to answer this question? Cynthia, Graham, Frank, I'm putting you on the spot, guys.
Sure, why not? I mean, the virus is pretty big, right? So what I don't mean, you say absorb directly to the skin, I'm assuming you don't have any cuts, right? If you're talking about absorbing through the pores of your skin, then I'd say that's really highly unlikely. Now, if you have cuts, then, you know, that's a different matter. Things can get through them, you know. It's a question of how big is the opening, and the opening on the skin is not big enough.
So is it mostly through the eyes and the nose, isn't it? And obviously the mouth.
Yeah.
So this is another question. Do we know what percentage of transmission occurs via air versus common surfaces, for example, an office space? Do we have any information about that?
I haven't seen any studies that actually are able to go to that depth. Everything I've seen sort of, they can point to people who were infecting other people, but much of the ways where the people have said it's a surface contact or through the air, I haven't seen people getting it down to that granular level.
Mm-hmm. So the other question here is, oops, sorry, I might have lost it here. When talking about foggers, how small does the microns have to be effective? What liquid and how often do businesses need to fog?
So that's one of those key questions that nobody really knows the answer to, because you say it's which solution. So you could pick whichever one you want. The solution of 200 part per million peroxide. Take a solution strength. Then you've got to look at the surface that you're dealing with, and then how much liquid do you deposit onto that surface. And it's likely going to have to be more for a tabletop than it's going to be for the walls. And then what's the frequency? You're going to get into the question of how many people are using that surface during the day. So there's an awful lot of people fogging, and people fogging all sorts of different chemicals. But nobody's really gone through to try to quantitate what is the dose that people need to use, and what kind of reductions are they seeing in terms of bacterial counts and bacterial properties. So that's actually a huge gap.
What I would say though is for any product that is sold commercially as an EPA registered or Health Canada registered product will have a DIN number or an EPA number. And it's a long time. It's usually about 18 months for any company to get that type of registration. And they do provide a lot of studies around, again, assumptions that they've used around the concentration. They have to list all the use cases, how they do that. So my thought would be is if you're looking at using any of these technologies that are commercial, their technical service department will be able to provide you with all the studies they used, all the data that they provided to Health Canada or the EPA, and provide a lot of, part of the requirement is they have training videos, all the documentation to answer the use case questions. Is it perfect? No, but it does come back to fundamental science, and that is peer reviewed before they're allowed to sell the product.
So more work, I guess, needs to be done in understanding.
I think the information is there. The information is there based on the units. If they're commercial, the people that would have it are the people that are selling it, because that is a legal requirement that they've done that due diligence. Their technical service would be probably better than any of us on this panel. So if you were to buy a fogging unit from a company using a chemical that they recommended, they would have all that supporting the questions that you would want answered.
Perfect. I guess this question is for you, Diane. The FDA and USDA say you should not wash produce with soap. A peer-reviewed publication from UC Davis explains that antibacterial soap and dish detergent residues can remain on the produce. Fruits and vegetables are porous, and those microscopic pores can absorb the residues, which are not for human consumption. That's an excellent question.
Yeah, again, there are a lot of excellent products on the market that are designated as fruit and veggie washes. So that are designed very much for high rinse. They tend to be more natural products like citric acid, acetic acid. They wouldn't be antibacterial soap. The way I would explain this one is much like, I think we know that hand washing, good old-fashioned hand washing, is better than sanitizing because it actually takes off the contamination. And again, when we're looking at fruit and vegetables, it's not just bacteria and fruit, it's people touching it, and it can be lots of things on it, right? So think about how you want to wash your hands is as important, if not more important, than using a hand sanitizer. A good fruit and vegetable wash will do the same thing, and if you wash it well, you don't need to sanitize or disinfect it.
Perfect.
Lots of good ones on the market.
Excellent. Thank you, Diane. I think that should have been our last question, because now I'm looking at the time. It's 2 minutes after 3. So I know that there are 10 questions that are already answered online. So for those who ask questions, if you can check the Q&A, you can see that most of your questions got answered online in typing, and we picked some of them now and we answered them live. And if you have any further questions, please do not hesitate to contact any one of us directly. And yes, you can have a copy of this recording for those of you who are asking. So we will circulate to all those who registered a link that has a copy of the webinar. So thank you again for all our panelists for their fruitful discussion and insightful information. It was really interesting, and thank you again. And we are looking forward to overcome this COVID and get our lives back to normal. Thank you so much.